Gemeenskap in Aksie is 'n 93.6 FM inisiatief wat mense aanspoor om 'n positiewe bydrae in alle gemeenskappe te lewer. Skakel elke maandagooggend om 10:00 in vir Radio Helderberg se Gemeenskap in Aksie program.
Well, it is time for Community in Action. It is a Monday, and I have in the studio a very interesting CEO of the Health Promotion South African Trust, George Arrey. He's French, and he's going to speak French to me. Bonjour.
Bonjour, ça va bien?
I don't know what else to say. I would love to speak French, but as I said to you off air, I can speak other languages, but not that. Never worked for me. George, just pull the microphone a little bit closer to you so we can hear you nice and clear. Yes, that's it. Okay. There we go. Sure. He was born in Cameroon, giving a few secrets away here. He speaks French, he speaks English, he speaks Xhosa, and I'm sure you speak more languages than that. But welcome to Radio Helderberg.
Thank you so much. It's my pleasure to be here.
You're now based in South Africa. You're not going back to Cameroon.
Yes, I'm based here. My wife is Xhosa from the Eastern Cape, and we have 3 children. So this is my home.
And I hope you're teaching your children French as well, apart from the other languages.
Yes, definitely I am. They know a few words already. So I'm hoping that in some years to come, they will be speaking fluently.
I think you can speak more than one language. It's such an advantage, really.
Yes, it is, indeed.
George, let's talk about the Health Promotion South Africa Trust. Prevention through education. Now, I must confess, I don't know much about you. Do you want to give us a short, brief history?
Yes. The Health Promotion South Africa Trust is a trust organization. We are based in South Africa, even though we have friends and supporters in the Netherlands, in America, and in Australia. Officially, we are called the Health Promotion South Africa Trust, but our popular name is the Health Promoters.
The Health Promoters.
The Health Promoters.
Right. Makes sense.
So we are an organization, a non-profit organization. We educate people in mostly the low-income suburbs and the underserved areas, especially in the Cape, about basic health and hygiene. So we are mostly, we are focused on preventative messages.
Now, you say you work in the lower income areas where I suppose these other services are not readily available.
Yes.
So you go in and you provide that?
Yes. We have realized that there is a strong link between ill health and poverty. And at the moment, the state is very active in providing curative and rehabilitative care, but there is a lot that needs to be done about education, because as you can see, we stand for prevention through education. So if you have to consider that, then you will realize that the people who are in the previously disadvantaged communities, they have a problem in terms of affordability of health care. So it is very important that they can be educated and be empowered so they can make informed decisions about their health and prevent themselves from getting sick. Because when they get sick, it becomes a whole big trouble for them to take care of themselves because of affordability. So we are based mostly in what I call designated health professional shortage areas, where you have, for example, one doctor to about 3,500 plus patients.
What?
So as a result of that, the primary health care centers are usually overburdened, and people sometimes find it very difficult just to see the doctor. So we think it is very important that you come in with some kind of an intervention where the people will be conscientized about their health and just learn basic skills of how to prevent diseases in the first place.
Absolutely. George, what programs are you busy with at the moment?
We are busy with a series of programs. We have what is called the ad programs.
Okay.
Ad, like the ad that is found in an email address.
Oh, yes. Okay, that little funny thing.
The little funny symbol.
Yeah.
The art programs, we have the health promoter at school, health promoter at work, health promoter at church, health promoter also at crèche. So these programs are tailor-made to suit the specification. We, for example, health promoter at school, we have realized that a healthy child learns better.
Of course.
So it is very important that this child, at their young age, begin to inculcate ideas or habits which are going to be healthy for them to look after themselves, so that they can be able to focus on their studies without getting sick. So we have highly trained health promoters who go to the schools and they train these children, and it is going with promising results. And the children are sort of conscientized about basic things like how to brush your teeth well, how to wash your hands when you come from the loo, how to eat healthy, those kinds of things which are going to keep the child healthy so that they can focus on their studies.
Yeah, now that you say eat healthy, a lot of children, doesn't matter where they come from, they don't realize drinking gassy cool drinks that there's so much sugar in there. Indeed. And they don't know what the sugar is doing to them and to their health. Indeed. So they become obese teenagers, which creates a whole lot of other problems.
Exactly.
So you've got to, from small, tell them, you stay away.
You got to get them while they're still young,
yes, so
that they can be able to understand the consequences of leading a life to have an unhealthy behavior towards their health. So while they are quite young, if they can inculcate that habit, then you have a high chance of a healthy adult, because then when they are older, the behavior or the attitude becomes spontaneous. They wash their hands when they come from the loo spontaneously. They watch out what they eat and stuff like that. So that's the intention, is to make them have the habit while they're quite young so they can grow with it.
And also tell them to exercise. Don't just sit the whole day.
Indeed. That is quite important.
Now, you've had success. What achievements can you talk about?
Yes. When we started a couple of years back, we trained a couple of hundreds of people, and we were very excited because we were sort of testing the waters, and it was working. But of recent, in the last 5 years, we have had an exponential increase in the number of people that have attended our workshops.
Wonderful.
So that is exciting, because it shows that people are becoming aware of keeping themselves healthy, and they're influxing our workshops and being willing to learn, because they have realized that it is very costly to take care of yourself when you get sick. So in the communities where we are based, we have all kinds of campaigns, word of mouth information, and people are influxing our workshops, and we are training thousands of people every year. In fact, we have realized that there is actually a ripple effect. If you train a 1,000 people, for example, you've not just trained those 1,000 people, because due to the awareness that they have, they're going to spread the message to their families and friends, and you will be reaching out to many other people without even realizing it.
Absolutely.
So we have, for example, in 2015, we trained plus minus 20,000 people. And you can imagine that if they have to train one person in their community, that is millions of people that we have reached.
Wonderful, wonderful. I'm just trying to work out the numbers here. Now, you mentioned workshops. How regularly do you do that?
Our centers, because we have 4 main centers, one in Kayamandi in Stellenbosch, one in Kayalicha, one in Mfuleni, and the other one in Langa. But we also go to other communities where we don't have a health information center. And our centers function from Mondays to Fridays. Mm-hmm. We have workshops where people attend at the center from Monday to Friday. And we also have outreaches, that is programs that we actually go to the venue, which is outside our center. And our health promoters, they work from 9 to 5, organizing and arranging these workshops. And so from Monday to Friday, from 9 to 5, we have workshops here and there.
Okay. And we have to talk about support. because it costs money. I'm sure you don't just have volunteers, you've got staff, you've got travel costs,
Yes,
all
indeed.
sorts of things. What sort of support do you need or do you have?
Yes, we, as you know, with every non-profit organization, we live on handouts, and our aspiration is to see that every community which has need for a health information center should have one. So we have a lot of need, first of all, for financial support,
Okay.
so we can train these health promoters, and also probably to open a health information center and extend our hands to other communities. So first, we need financial support, which ironically, we are based in South Africa, and South African population is the beneficiary. But at the moment, most of our funding comes from overseas. So we would really like to have local stakeholders and local corporates and foundations extending their hands to our organization, so as to, just to have the feel that we also supported locally financially.
Absolutely.
And also, we would also need to have people with expertise from various domains bringing their input in terms of volunteering and also in terms of helping us developing our programs.
I think it's a wonderful initiative. Yeah. How long has the health promotion been going?
We existed initially as a Medical Knowledge Institute, which was abbreviated MKI, since the year 2001.
Okay.
And but at some point we realized that the name Medical Knowledge Institute sounds too technical, sophisticated.
Yes.
And the people we reach out to, they sort of misinterpret our identity. They think we're some kind of medical doctors. So we decided to make it more generic, and also to simplify the name and just describe ourselves in terms of what we actually do, which is promoting health. So the name Health Promoters was actually the best name that we could go by. So we find that the name is actually well publicized in the communities and well received in the communities that we work.
And that's what you want.
Yes.
Chatting to the CEO of Health Promotion SA Trust, Health Promoters, George Arrey. Do I say it correctly now? Arrey. It's such a beautiful name. George, for people to get in touch with you, they might want more information. What are the different ways of getting hold of you?
We are found in social media. So if you can visit our Facebook page, which is www.facebook.com/health promoters. Our Twitter page also is www.twitter.com/health promoters. We're also found in Instagram, which is also www.instagram.com/health promoters. Our website is www.healthpromoters.co.za. And if you want to contact us by phone, our phone number is 073 875 9524. And an alternative number is 073 299 7947.
I think the easiest for people would be to go to the website, because all the links should be on there.
Yeah,
and then Facebook, everybody's on Facebook.
Indeed.
Go look for the Health Promoters. George, so nice to meet you, and you're so enthusiastic about this. I wish you a lot of success with this. There's a need for this.
There is quite a need for it. We are getting to times where people need to look after themselves, because it is quite costly to have medical care, especially the disadvantaged, formerly disadvantaged people who have low income. It is quite important that they look after their health, and the best way to do that is to be informed about basic health and hygiene knowledge.
Okay, so prevention through education.
Prevention through education.
George, so nice to meet you. I wish you all the best.
Thank you so much.
And I hope that 2018 for you guys are going to be a stunning year.
Yes.
Thank you so much.
It's been my pleasure to be here. Thank you.